presentation-packed session this morning, so I'm going to go ahead and get started. I'm Susan Ackerman, and I am the William C. and Elizabeth M. Troy Hopp Chair in Health Planning with the Center for Community Solutions. And thank you so much for joining us this morning for our final Human Service Institute of 2013. Health Reform in Ohio, what's next? Clearly this is a very interesting topic for everyone, and I'm glad to see so many people here this morning. Before we get started, I want to thank our sponsors this morning. Our co-sponsors for this morning event are P10 and Nordson Corporation, and our additional sponsors are Jones Day, Metro Health, and Mount Sinai. Give them a round of applause. Before I introduce our keynote speaker, I'd like to thank the Cleveland Clinic for hosting this event this morning. And to offer a few words, I'm going to introduce Kristen Morris. Kristen is the Chief Government and Community Relations Officer for the clinic, and she's fairly new here. She's got a lot of federal experience and has done a lot of work in Washington. So let me introduce Kristen.
I actually think they just gave me this opportunity because I am new, and I just wanted to say hi. I'm Chris Morris. I'm new here at the clinic. I've been here for all of 3 months. And I really hope to have the opportunity to work with all of you, especially as we go through what is going to be an extraordinary period of change. And just as a major social policy, there's going to be a lot of work that we're going to all be able to do to, I think, advance and evolve, whether it be the Affordable Care Act or Medicaid reform at the state level. And I really am actually excited about this new change in the new environment we're entering into. So anyway, Cleveland Clinic is really proud to host this last event of the center. As I was looking at today's comments, I just wanted to note the events that the center's hosted this year have just been amazing, and I think this one is going to be the pièce de résistance for the year-end events. They have about 100 years of advocacy and action that they've done on behalf of the community. And the Cleveland Clinic's been around for at least 90 of those years, so we have a long history of a relationship. And I used to know Greg when he worked, Greg Moody, who you're going to hear about in a minute, when he worked in Washington, D.C. And Governor Kasich, then, as the chair of the Budget Committee, was always known for being very forward-leaning on budget policy, and particularly health care, since it was such a key component of the entitlement program. And the kind of commitment that governments have to make to maintaining that element of our community. So I know we're going to be having enormously impactful leadership, just again, continue through the state of Ohio, and I think we're going to be a landmark nationally for how we can really be effective in evolving our healthcare system. So with that, I just wanted to say thank you for coming here and finding the Bunz Auditorium. I know it's a challenge, but it'll be worth it. And with that, I'd like to hand it back over to have our keynote speaker introduced.
Thank you. And actually, just remind you, for those of you who know me, I know a lot of people in this room, you know that when I stand up and you tell me something I don't think when I stand up. So I remember being given told to shut a button down, which I did not shut down. That makes a lot more sense now. Okay, thank you all. So many of you know Greg Moody. He is the director of the Governor's Office of Health Transformation, and he's been doing that since January of 2011. I had worked with Greg in his prior job when he was with Governor Taft, and back in those days, we spent a lot of time talking about how we can make Medicaid cost less. And I have to say, Greg has been instrumental in really changing the discussion in the Medicaid program and talking about not only how can we make the program more sustainable at a lower cost, but really how can we improve the health outcomes for people. And I think that's a really remarkable task that he has achieved. Greg has had a lot of experience in both the private and public sector and health systems. He's worked for over 20 years in Medicaid program design. He was a senior consultant with Health Management Associates, where he produced health research and consulting services to healthcare providers and advocacy organizations nationwide. He was formerly the executive assistant for Health and Human Services under Governor Bob Taft. And as Kristen said, he began his career in public service back in 1991 as a budget associate working with then U.S. Representative John Kasich for his budget committee. So with that, I'd like to welcome Greg Moody.
Well, thank you. Very happy to be here. Center for Community Solutions is a fantastic partner in terms of elevating the level of policy conversation here in this part of the state, but around the state. A lot of what you do is very influential and very influential in the State House. And thank you to the clinic for hosting. It's wonderful to be in a room like this where I can see all of you directly. It's a wonderful space to be in. There is a lot going on in health policy in Ohio. It is a wonderful time to be involved in health policy if you can handle the anxiety of uncertainty. There is a lot of uncertainty. But hopefully out of the disruption that's occurring, we find our way to better ways of providing health care. For too long, I think we've been aware of the things that just aren't working, the things we've put up with, and I'm not sure why we put up with them. Why do we pay for more and more and more and more instead of better and better and better and better? So I think we're at one of those times where if we can bring enough focus to it, we have an opportunity to actually change outcomes, better health, better care, and better stewardship of the resources we use. So what I wanted to do, this is from the state's perspective. This is just one part of the viewpoint. Plans and providers and patients, there are different viewpoints, but in terms of stewardship of state dollars and the objective of improving care for Ohioans, I wanted to walk through some of the things we've been working on in the state of Ohio. The first is we've been very rigorous about what is a seemingly oversimplified problem definition, but this is a very powerful combination. A few people account for most spending, and the system is fragmented, and things go wrong as a result. Many of the challenges we have in healthcare track back to some combination of this. And particularly where that individual who didn't have to be expensive, but the system broke down around them, and they unnecessarily became expensive, that is a good place to focus. Because if we can catch that before it happens, we have an opportunity to keep them well and spend less. And that's the magical combination in terms of health policy and budgeting. So then these challenges have kind of counterpart strategies related to them. A few people account for most spending, so how do we look at that? How do we focus on that? Government tends to do the opposite. Those few are very complicated. They're elderly, often disabled, and politically fearsome to an elected official. So instead of focusing there, you work around the edges. We're going to increase co-payments on everybody. We're going to do something to everybody. But most folks consume very little resources. So you have to be brave enough to focus on the few who are very expensive, and then be very willing to see that often you're the culprit in why their care broke down. We divide things up. We have a Department of Aging, a Department of Mental Health, a Department of Medicaid, often running down separate tracks. That is not unlike big, complicated health systems, where your departments hopefully are coordinating, but sometimes they don't. So how do we coordinate for the folks who need it most? There is a bigger idea here than just save some money. Our programs are oriented to be convenient for the programs. Funding comes for a program. You're eligible for a program, but what people need is more complicated than that. They need several things operating at once for them. Transportation and healthcare and housing, a combination of things to meet their needs. We have to be more person-centered in terms of understanding those needs. Independence, not dependence. Prosperity, not poverty. Medicaid should be temporary as a person finds their way to higher income and then doesn't need the program. How do we constantly think that way? Innovation, not bureaucracy. We have considerable resources in the state of Ohio already focused on this. In healthcare alone, we have $22.2 billion of healthcare that we purchase. Most of that is through the Medicaid program, but also included here is the health care we purchase for our state employees, for prisoners. There are a lot of places where the state purchases health care. In education, almost $14 billion in workforce and other social services. So we have tremendous resources. Are we spending that as well as we can? I think there's enough money in the system. The question is, what are you doing with that money? You can slice this a different way and think about kids separately. Each of these categories spends on kids, and when you pull that out and look at it as a whole, we spend $18 billion a year on kids. If you divide that up by the number of kids in Ohio, it's $5,000 to $6,000 per child in Ohio. Now clearly we spend a lot more on some kids and spend very little on others. But surely if we have resources to the tune of $6,000 a year for every child in Ohio, we can figure out how to achieve prosperity and independence, not poverty. The governor, I think the real key insight into his leadership when we came in terms of what's allowed us to be effective, he said, basically work in teams. These separate categories aren't working, pull people together. So my task was to pull people together around health transformation, to modernize Medicaid and improve overall health system performance.